Hi. Great to see you, man. Hi.
This is Alex from Gilead.
Good.
Hi, how are you?
How are you? Great to see you. Great to see you.
I came from Kazakhstan.
How are you?
Wonderful this morning. Thank you so much for that.
So which one is mine?
Okay.
Yep.
Great to see you. Thank you so much. Thank you. No, thanks to you. Thank you.
We're so happy to be collaborating with you. Thank you.
Yes, if you remember that, you, David, Debbie Burks, and myself, four of us, did your population announcement. Yeah. It was marvelously received, and then there were two recipients, I think, with us. Yeah.
I'm saying it's hotter here than it was in Turkey.
Heb je er een foto van gemaakt, Louise?
It's all climate change. It's real.
Who talks about?
I don't know. I think you're
chairing
moderating.
an
Ja, zoveel hebben we nog niet eerder gehad, hè?
So. Good afternoon, everyone. I'm very pleased to welcome you all to this official press conference on Eastern Europe and Central Asia. I'm Dr. Chris Beyrer. I'm a Desmond Tutu Professor in Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health, and I'm the immediate past president of the International AIDS Society, at least until this Friday. As many of you know, Eastern Europe and Central Asia is one of the only two regions in the world where the HIV epidemic is currently expanding. And where new infections continue to rise rapidly. New infections are up 30% in the Eastern Europe Central Asian region since 2010, according to the latest UNAIDS estimates released just last week. And just a few days ago, the International AIDS Society and The Lancet released a commission on the future of global health and the HIV response. And in that, we called for immediate action to link, integrate, and synergize HIV services with other health services in this region. And I'm delighted to say that that work was supported by the Elton John AIDS Foundation, and we deeply appreciate it. This will be crucial, the integration of services in Eastern Europe, because overdose is also a major cause of loss of life, and HIV has emerged as a major cause of mortality, particularly among people who use drugs and who inject drugs in the region. In the Lancet Commission report, we published modeling data which showed that integrating harm reduction services, overdose prevention, antiretroviral therapy together could avert between 36 and 50% of new infections in two high-prevalence Russian cities over the next 10 years. But very importantly, that would also reduce overdose deaths by a third. So it is so important to save those lives. It's clear that bringing these services together for marginalized populations has the potential to really improve health outcomes in Eastern Europe and Central Asia and the world, and the time to act is now. Virtually all of the new infections in this Eastern Europe, Central Asian region are occurring among key populations, and that's what we're here to talk about today and to learn about some of the extraordinary initiatives that the people on this panel are going to share with you. It's incredibly important work, and you're going to hear about some new commitments to reach those most in need of prevention, treatment, and care. In a moment, you'll hear brief remarks from our panelists, and then we'll be glad to take all of your questions. Let me now introduce the first of the speakers on the panel this afternoon, and that is my friend now for a number of years, Lambert Grijns. Lambert is the Director of Social Development Department, and he has a unique role. It's one of those only in the Netherlands positions. He is the Ambassador for Sexual and Reproductive Health and Rights and HIV/AIDS at the Ministry of Foreign Affairs of the Netherlands. He's also a member of the advisory group for the Guttmacher-Lancet Institute on Sexual and Reproductive Health and Rights. He's a member of the high-level task force on the International Conference on Population and Development, and he's going to share some of the Dutch government's successes in this area and talk about some new initiatives in Eastern Europe and Central Asia. Lambert, the chair, please.
Thank you very much, Chris. Very kind of you. We've been working on this HIV/AIDS conference already for 5 years, and when we took this initiative 5 years ago as a Dutch government, together with other Amsterdam-based organizations, we had to present a kind of bid book to the International AIDS Society, which was presided by Chris Beyrer at the time. And one of our main arguments was we need to have a conference in Amsterdam because it's a conference in Europe. We need to have the spotlights on Europe for 2 reasons. First of all, as you already mentioned, we are very much concerned about the very in Europe, especially in Eastern Europe and Central Asia, but also in some other European countries. The second thing is the striking political indifference at European capitals and in Brussels. So this conference, basically, although it's a global conference and it's meant for the whole world, is basically also meant to ring the alarm bell around Eastern Europe in European capitals. Now, I understand we will also hear, and I'm an optimist by nature, also hear some positive stories later on in this panel. And I've been traveling myself in many countries in Eastern Europe and Central Asia, and I've seen how governments basically are struggling, and especially at local level, municipalities, they do want to do something. Harm reduction programs in Belarus, where clean needle exchange and opiate substitution programs with methadone are being used. Or did you know that there is methadone provision in prisons in Tajikistan and Kyrgyzstan? I've seen programs, very courageous programs on MSM, men having sex with men, harm reduction activities even in the heart of Moscow. You couldn't imagine it. It does exist, but in many cases there. Then the other good news is yesterday we had a very significant political mini summit, if I may call it that way, here in Amsterdam just prior to the opening ceremonies. There were 10 ministers from ministers and vice ministers of health from the countries in Eastern Europe and Central Asia. They were here to provide the successes which they are fragmented. And there's a lack of coherence between ministries, and not everyone is basing his policies on evidence. The most important challenge is stigma and discrimination, and it would be too easy to put that only on the shoulders of governments, because it is something which is rooted in societies, where the church is playing a role, where teachers are playing a role, where families are playing a role, where media are playing a role, and where most importantly civil society is playing a role. And I think that's exactly the reason why we have decided to support civil society and to support in particular the Elton John AIDS Foundation. So the Dutch government is happy to announce in Eastern Europe and Central Asia. We believe in what you're doing and we congratulate you for what you're doing. Thank you so much.
Thank you so much, Lambert. Our next speaker, we're so delighted and honored to have back with us at the International AIDS Conference, a true friend of the IAS and, more importantly, a hero in the fight against stigma, discrimination, and HIV/AIDS. Sir Elton is a longtime champion of the global AIDS response. He was with us at the last International AIDS Conference in Durban in South Africa. In 1992, he founded the Elton John AIDS Foundation, and that foundation has raised more than $400 million to combat stigma, prevent infections, provide treatment and services, and motivate governments to end AIDS. He's going to discuss the Foundation's work in the region and the need to support key populations. Sir Elton, please.
Thank you. I would like to thank Ambassador Grijns and endorse his remarks. I congratulate his government for hosting this conference in Amsterdam and for an increased focus on Eastern Europe. Over the course of my performing career and my work for the Elton John AIDS Foundation, I've had many occasions to visit Eastern Europe. I've developed a tremendous affection for the region and its wonderful people. I was the first major Western artist to have an opportunity to perform a concert in Russia before the dissolution of the Soviet Union, and I've returned there many times since for trips and concerts. I've also visited Ukraine many times, and to see the work of my foundation is supporting there, and twice specifically to perform AIDS awareness concerts. I recently had the opportunity to visit Armenia, and I certainly want to return to Eastern Europe for more visits with the people who are doing such important work in the region, often against incredibly difficult odds. Let me just come off piste here and say that this is a really, really bad problem we are facing here. This is, you know, my speech is saying I go there and I do that. I tell you, we have an enormous problem in Eastern Europe, especially in the ex-Soviet Union, in Russia, because of the failure of people to recognize people who need the drugs and giving it to the elite few, and especially not to the LGBT population. We face an enormous problem there, but we are in talks with the Russian health minister, and you know, we have to talk. Everyone has to talk. Everyone has to communicate with each other to further our fight against AIDS and to make these people's lives a lot better. The HIV epidemic in Eastern Europe is still increasing. Oh boy, is it. It's one of the few regions in the world where the statistics are getting worse and worse and worse. Based on our experience with HIV/AIDS in other areas of the world, we know we must respond by working with scientific and medical experts as well as with government officials. But that won't be enough. It is vital for us to engage with people who are directly affected by the epidemic, and especially with vulnerable populations who are often cast aside by society. People who inject drugs, LGBT individuals, and sex workers, and prisoners. At the Elton John AIDS Foundation, our core philosophy is to engage people in need by understanding and accepting the circumstance of their lives, without judgment, but with unconditional love. We help them no matter who they are, what they do, who they love, where they live, or what they believe. Because the only way we can end AIDS is by ending it everywhere, for everyone. I'm very pleased to introduce Louise van Deth, representing Aidsfonds, our partner and co-funder in the new emergency fund for key populations in the region who are under threat of losing access to HIV services. Through this fund, we will quickly distribute resources to grassroots organizations in 10 countries as emergencies arise. Thank you.
Thank you so much, Sir Elton, for that introduction. So we are talking about a huge crisis in the region, and there are very few donors working there. While there are emergencies happening every day, we're talking about poorly functioning health systems. We're talking about discriminative and conservative attitudes and laws towards those who need it most, the underserved, the vulnerable populations. Just one example, I met a couple, 2 men in the region, who both recently tested positive for HIV. They were in shock, and they had gone recently to a doctor and had asked the doctor for advice. The doctor left the room and came back with an official who said that for them there was no free treatment. For homosexuals, no free treatment. And he threatened them with criminal prosecution and imprisonment. And this is only one of very many stories. So we are joining forces, the Elton John AIDS Foundation and the Aidsfonds to help local organizations and activists to confront this crisis. And we really hope that this inspires others to do the same, because it's only two of us and there's a lot needed in this huge crisis. We really hope that other donors will also turn their attention and money to the region. We at Aidsfonds always work with the communities concerned, because they know best, they know the realities on the ground, and they know the people. And we have a lot of experience in working directly with key populations. Aidsfonds partners with AVIEW, who has been a long-standing partner and who has local offices in the regions. So we are announcing today the Elton John Aidsfonds, Elton John's AIDS Foundation Aidsfonds Emergency Fund, which will offer rapid response and grants directly to community-based organizations, so they can tackle human rights violations, offer legal support, and so they can tackle health emergencies like ARV stockouts. Thank you.
Thanks so much, Louise. Our next speaker is Anne Aslett from the Elton John AIDS Foundation. Anne, please.
Thank you. As Executive Director of the Elton John AIDS Foundation, thank you. I'm very proud that our efforts to address the most persistent problems in the fight against HIV and AIDS and to break down barriers to life-saving treatment, especially in underserved areas. Through this innovative new fund, both the emergency fund that Louise has spoken about and the broader Eastern European and Central Asia Fund, we will introduce new means of scaling up responses to HIV and AIDS epidemic in Eastern Europe and Central Asia. Other members of the panel have laid out the statistics and the need for urgent action. It's really clear that we have to do something right now. Having seen at first hand what the Elton John AIDS Foundation and others have been able to accomplish in Ukraine, where we've been funding for over 15 years, when we marshal our efforts, we are really optimistic that we can make positive change. This fund will support innovative organizations working to address the critical issues that Lambert and Louise have laid out. We're very honored to have two of the first grantees from the fund with us here today to tell you a little bit more about their work. Alexey Lahov is from Humanitarian Action, an organization that is scaling up innovative HIV services for sex workers and people who inject drugs in St. Petersburg in Russia. And Assel Terlikbayeva works with the Global Health Research Center of Central Asia, which is developing a digital campaign that links gay men in urban Kazakhstan to self-testing programs and other HIV services. So please, tell us more.
Alexey, or who's going first?
Okay. Thank you very much. Thanks for this opportunity. Do you hear me? Yes. At all? Okay, great. First of all, I would like to thank everybody for giving me this opportunity, for giving our community this opportunity to be here today. And I am really honored because 20 years ago, when I started using drugs, I couldn't even imagine that 20 years will pass and I will be sitting here and talking to you, talking about scaling up of some harm reduction initiatives. This is a case that is not very simple in Russia because, as you might know, we have a very repressive drug policy in our country, and so harm reduction services are not very widespread. But I am lucky. I am lucky not only to be alive and to be here with you today, but to also be from St. Petersburg, because St. Petersburg is unlike any other Russian city. Because, and it is not like any other Russian city just because we have harm reduction services. And this is like a very surprising, when I'm talking about it, everybody is being surprised because we have HIV epidemic in Siberia, for example, and we do not have harm reduction services there. But in St. Petersburg, this is a very European city, and we have a harm reduction service there, and hopefully we will be able to scale it up and to show to our government and to other Russian regions that we are able to make something of it, that we are able to be there for people who need us most, because our case managers are former or current drug users themselves, and they understand what services are needed to this vulnerable community. And I hope that this grant, this immense opportunity will allow us to scale up our operations and to maybe have some, and to have our voice heard at the level of the Ministry of Health, at the level of the federal government. And I would like to thank you once again for this nice opportunity. And if you if you have any questions, just please ask them. Thank you.
Thank you. Assel?
Thank you very much. I highly appreciate this award. And I'm very proud to represent my country, Kazakhstan, here. For the last 25 years, Kazakhstan became a real leader in the region, and it made a lot of progress in transforming its healthcare system to address global health challenges, including the fight against HIV. Just to give you a few examples, Kazakhstan is the only country in the region with HIV treatment programs fully supported from the state budget. And Kazakhstan is providing funding for non-governmental organizations, for harm reduction programs and prevention programs. However, this funding is still inadequate, especially given the decreased donor support for the region. Kazakhstan adopted many international recommendations for HIV prevention and treatment. And up until now, HIV was primarily driven by injection drug use in Kazakhstan. Yet, drug treatment programs and harm reduction programs remain limited, especially the methadone program is in critical stage in Kazakhstan, unfortunately. But the epidemic has changed, and now the sexual way of transmission is rising, and the rates of HIV among MSM increased 2 times in the last 5 years. MSM become disproportionately affected with HIV and the least covered with prevention services in Kazakhstan. Only 18% of MSM were tested and know their status, which is unacceptably low, and HIV testing in the community remain very limited. High stigma and discrimination exist and limits access to services. And with this funding from Elton John AIDS Foundation, we hope to be able to address some of these gaps. In particular, we would like to expand safe, confidential, and easy self-testing among MSM and transgender people in Kazakhstan using online platform and social media. So tests will be ordered online and delivered using the post. And we also will provide online consultation and physical assistance to those who will found positive to link them to care. As a research agency, we also will do evaluation component to assess the effectiveness of this approach. So let me once again to express my deepest gratitude to Elton John AIDS Foundation for their attention to our region and for this invaluable opportunity to continue our work with least covered and very marginalized population like MSM and transgender communities in Central Asia. Thank you.
Spasibo большое. Our final speaker for this afternoon is Alex Lahov. He's Vice President of Public Affairs for Europe, the Middle East, and Africa at Gilead Sciences. And he's going to share with us Gilead's support for the Eastern European and Central Asian region and its commitment to access to medicines. Alex, please.
Thank you, Chris. I hope you can hear me. Firstly, on behalf of everyone at Gilead Sciences, I'd like to say what an absolute privilege and honor it is to be part of this partnership with the esteemed people on this panel. At Gilead Sciences, we recognized very early on that apart from the science and innovation that we have contributed towards transforming HIV treatment, that is only one element of what we can and should do. You can, in theory, have the perfect pill, but if that perfect pill is not available to the people that need it the most, it's not used to anyone. And that's especially true in the region we're talking about today, with infection rates that have been quoted already. We already have 10 Eastern European countries as part of our access program, but we knew there's more to do. And we knew you can't also tackle Eastern Europe without also addressing Russia. And what we knew for sure is that we couldn't do it alone. We needed to find a partner that had the capability, the know-how, the network and the infrastructure on the ground that could get things done. And I think it was around that time when we were thinking about who would be an ideal partner for us to work with. We had a meeting with Anne in London, and literally within 10 minutes of the meeting, it was just meant to be a general meet and greet, but within 10 minutes we were throwing ideas around what could we do and how could we support EJAF's efforts in Eastern Europe. And so I'm delighted to say that apart from our financial contribution that we've made towards the fund, as a pharmaceutical company, we were thinking what else we can do. So it's already been mentioned that peeweed population is a particular challenge in the region, and that's why one of the ideas that came up as part of that meeting is the fact that we could donate 5,000 hepatitis C treatments as co-infection rates between HIV and Hep C are very high in the region. And we're doing that at the end of this year, beginning of 2019, over a 3-year period. And we are working the details right now, but we want to make sure that donation and that treatment reaches the people that need it the most. So beyond that, I'd like to say my final message really is I hope that this is the beginning of this partnership. We're already talking about exciting new ideas about what else we can do. Can we do more? Can we reach more people? And I'm pretty certain that this is only the beginning of the initiatives that we'll be able to announce so that we can really change the HIV trajectory of this region. Thank you. Thank you for allowing us to be part of this.
Thank you so much, Alex. And now we're ready to open this up for the Q&A. You'll see that there's a microphone right behind you, so we'd ask for people to please line up at the microphone. When I call on you to ask your question, please indicate your name and your media outlet. Please keep your questions relatively short. Sir, please. Is the mic on?
No.
Okay,
that's what
speak
we
right
do.
into it,
Yeah.
please.
My name is Jan Huiblands, Dutch journalist. First question is to Alex, and that question is, did you mention 3,000 treatments hepatitis C in 3 years?
5,000.
5,000 in 3 years.
And it will be focused on Russia, yes.
Okay, thank you. And the other one is to Ambassador Grijns. You mentioned the indifference in Brussels, and hearing the statements from the other people in the group. My question is: would you say that the EU or Brussels could require better performance to let Eastern European countries, governments toe the line, like the EU is trying to do with migrant policy, for instance?
Thank you for the question. The most important message of this AIDS conference is AIDS is not over yet. We are really quite successful. We've been successful. We know what works. We know how we can get there, but it's not over yet. And in many capitals in Europe, like in the Netherlands, we see the enormous progress which is being made and which has been made over the last couple of years. Like in the Netherlands, the number of new HIV infections is going down consistently. That's a huge success. We see the successes which we see in African countries. But we do not see, or we do not want to see, the enormous rise of infections in almost 50 countries worldwide. And there, I think, and that was my advocacy, I think that we as governments should be aware of what's happening in the world, not only in our own countries, but also on our doorstep in Eastern Europe, which is only 1 day by car from here.
May I add to that, Chris?
Surely, briefly, if you would.
Yeah,
Louise.
just briefly. It's really a matter of political will. We know what to do, but the governments of countries also have to decide to do the right thing, and that often doesn't happen.
Thank you. Next question, please.
Rinke van der Brink from the NOS, the host broadcaster of the conference. Sir Elton, could you be a little more specific on the project that will be paid in Eastern European countries, the way the money will be used?
Perhaps I can add a little bit to that, which is that we are going to approach this at various different levels. So as we've announced, we're going to have an emergency fund which looks at an emergency response, very much smaller grants going out. We also want to have community grants to try and build a real response in the various different countries where we're working that'll be longer term, where services will be available. And finally, we want to do lighthouse grants. We want to work within the health system, because what we've learned over years is that if you try and set up an entirely parallel system, once the funding finishes, those services disappear. So we're going to use lighthouse grants to build capacity within the public sector, particularly within AIDS centers, so that we can make sure that we can get more people tested and put more people on treatment. The process is a open grants process. We put out calls for proposals at the beginning of this year, and we, along with our partners, go through an open process to determine who gets funded.
Yeah, my name is Pavel Lapkov. I'm from Russian TV rain channel and also from Spitz Center, and probably we met with Mr. Elton John in Moscow. So are your partners in Russia reliable? Do you trust all your partners? Are you sure that the money wouldn't disappear on the way? How they would be controlled? And there are regions which are very close to media, like Moscow and Petersburg. And there are regions with epidemic growth, where epidemic grows, like Siberia and Ural regions. Are you sure that the money will be distributed uniformly to the people who really need them? And organizations.
Well, we work with organizations that are based along the fact that they're working with people with HIV. We don't really give money to governments directly. We've never done that. We set up a template and then try and work with the government once the template works. We are in discussions with the Russian health minister. We saw her in Moscow last November. I understand your pessimism because the facts and figures that we got from the Russian health minister weren't exactly the facts and figures that we thought were exactly right. But I'm a great believer in that we have to work together and we have to build the bridges. And I think as an organization, we've never, ever lost any money or given any money to anybody who's wasted it. Right, Anne? Never. We are a very thorough-minded organization. We set out to give money and to make sure that that money is spent in the right way. There's always a first time. I'm not saying we're perfect or anything like that. And we know what we're up against. We're not stupid. But we're up against something, but we're going to work together with the government. And we want to explain?
Just to add to that, I think, we have been working in the region, not in all of the countries in the region, but we've been working in Russia and Ukraine for 10 years now. We, as Elton says, we tend to work with NGOs that are run by people who are directly affected by the epidemic. And so they have much less motivation to want to misuse the money because they want to see the money being spent in the best possible way to benefit their community. So we've been successful at doing that. And then exactly as Elton says, we put pressure on government health systems to respond. We're never funding those systems directly. And you have to work with what you have. It's a huge problem in Eastern Europe that we can't walk away from, so we will work with what we have.
Louise from the AIDS Fund may want to comment on the accountability of funds in their experience. Please.
Yes, and I've met quite a number of really grassroots organizations in the region, also in Russia. I was there in April. And these are organizations which are doing their work under really difficult circumstances.
To be foreign agents, for example. To be
yes,
foreign agents.
Yeah. Quite a number of them have been marked foreign agents. But they continue their work. They're working with the people who work there are former drug users. They are the communities themselves. They will do the work whether there is money or not. But obviously, they will be able to do the work much better if they actually have support, if they have financial support. They can upscale their services. And I've been really, really impressed with the determination of these organizations and the people who work for them.
Thank you. Next question, please.
Okay.
Please keep it brief, because there's a long line there.
Okay, my name is Samuel Getachew, from a reporter from Ethiopia. My question is to Sir Elton John, sorry. I don't know if I should call you Brother Elton John. But the question I have is, the last time you and your friends got involved in such a big project was through Live Aid that helped Ethiopians, the country that I come from. But that was during the Thatcher government of '84. Right now, you have another conservative government. Is this in response to the leadership that's missing from your government? And should AIDS 2020 be pulled out of San Francisco in 2 years?
What government are you talking about?
Because of Trump. Thank you.
Well, the UK isn't funding Eastern Europe because it's a middle-income country.
Right.
And there's a huge amount of accountability. The government has to be accountable to people in the UK.
No, but you want to answer that? It's you answer it. You're better. You'll understand it better than me. I might get into a temper here.
Where's he gone? He's disappeared. I mean, we know that aid is being withdrawn from Eastern Europe, from the region. We're talking about middle-income countries here. There's an even tighter accountability for governments like the UK government in terms of funding this region. And so we have to, as I say, we have to work with what we have. They're accountable to voters who are less inclined to see support to other countries that are middle-income countries. So we work with what we have.
And I would just add that I think it's true for all the organizations here and also the IAS and many others that what is motivating us is the crisis that we're seeing. It's the rising AIDS mortality in a time when we have effective therapy and it's the rising rates of new infection. And that's
basically what it comes down to is that these countries are discriminating very badly against LGBT people.
Yeah.
And we have to fight that. And we are fighting it. To be an LGBT person in Russia is very difficult. I don't have to tell anybody else that. But we've made incredible advances in Ukraine, and it's a long way to go. You just put your foot down and you just keep going and you keep going. I will say one thing. I mean, the Russian thing about they don't mind about gay people, but they don't they're coming for our children. Well, I would say that's absolute nonsense. The heterosexuals have done that for years, and they've done it for us. So that is complete bullshit. I'm so anti what's going on for the LGBT community throughout the Eastern Europe. We're here to protect them for everyone who's HIV, but especially the LGBT community that have suffered so badly and are still suffering, and it makes me fucking crazy. Okay? And if there wasn't this discrimination, we can get rid of the disease far quicker. We wouldn't have to be sitting here 2 years after 2 years after 2 years saying the same bloody thing over and over again.
Exactly.
Thank you.
Ready to follow that? Next question. Next question.
Well, hello. My name is Hanneke van Houwelingen. I'm a Dutch journalist working for a Dutch newspaper, Algemeen Dagblad. My question is also to Sir Elton John.
Oh.
I was wondering, do you have plans to visit Russia again, maybe during your farewell tour? And what do you want to point out to the government? Well, maybe you already did that.
What's that?
Sorry, what was the question?
Visiting Russia, maybe during his next tour, and does he have plans to say anything to the government when he's there?
When I go to Russia, first thing I do is try and meet with LGBT AIDS groups to find out what's going on the ground. People have said to me, you should boycott Russia because of what's going on. You can't boycott people. You can't leave people. You can't say, well, we're isolating you, we're not coming, we're not going to help you. That makes people feel terrible. Whenever I go to somewhere like Russia or Ukraine, I always try and sit down with the government. I did so in Armenia as well, to say, what can we do? How can we help? We know that it's a difficult situation, but how, as an organization, as much as we hate is what is going on here, how can we help? How can we try and help you get rid of this disease? We have to work with these governments. And we must work with governments, otherwise we'll be barking up the wrong tree. You understood my anger and my previous remarks, but it's so terribly frustrating for us all to be in a room like this when we know exactly, if there wasn't this bigotry and hatred, that this disease could be eliminated far quicker than you could ever think. That doesn't just apply to Eastern Europe, of course. It happens in America, it happens in Britain, but it happens in Eastern Europe a lot. It happens in the Middle East, it happens in Asia, and it's holding us back. And until we get that bloody idea out of our head that gay people are less than, then I am afraid we will still be sitting here in 20 years' time discussing the same fucking thing. Okay?
I'm afraid because we are running out of time.
I still want to know if you have plans to go to Russia.
Are you?
Russia's not on the tour.
We haven't planned Europe yet, but of course I would hope. I love Russia. I've never had anything but love from people in Russia. I love the Russian people. I went there in 1979. I love the Russian people so much. They've been nothing else but kind to me. This all happened from this idiot in St. Petersburg, and it's been backed up by the government. And I don't believe that all Russian people are homophobic. I don't believe that at all. But it's my duty as someone who is, you know, a visible a visible gay man who isn't HIV, to go there and try and help the situation but get better. Maybe I haven't made it better by saying what I've just done, but it's just frustrating me. And wake up, wake up, wake up.
Thank you. Thank you very much.
Please.
Hi. I'm Marius from Holland also. I'm working for the daily entertainment show Show News. So I have a question to Sir Elton John, of course. There I go again. So sorry.
Okay.
This morning you were on stage with Prince Harry, of course. How do you think about his involvement to the subject, AIDS, HIV, tuberculosis?
No, Prince Harry's involvement with the subject.
Prince Harry's involvement in this subject is just a wonderful thing happened because he has he communicates with younger people. Yeah. I'm 71 years of age. I don't maybe connect with young people as well as he does. He has his mother's remarkable ability to, if he walks into a room like this, to make everyone think that he's known you for years. That is a very remarkable ability to have. And he's also extremely a passionate man. And we need passionate people involved in this disease. Without passion, we won't get anywhere. He's so dedicated to this. And as a human being, the more I see him and the more I knew him as a little boy, and I see him as a man, and what I see, I like very, very much. You couldn't get a nicer, more determined person to help people than him, okay?
Wow. And how important is it that celebrities or royals are involved with this subject, that people speak out for AIDS, HIV?
Politicians involved. We want politicians involved.
We don't want celebrities like me. We want fucking politicians to start doing something. I mean, they're the ones that, you know, have the power to end this disease. It's not a member of the royal family. They can't do it. They can join the crowd. I can join the crowd. But I'm not President Putin. I'm not President Trump. I'm not a leader of a country. Politicians need to be more humanitarian. Otherwise, the world it already is going to hell in a handbasket at the moment. But politicians need to step up to the plate. They can end this disease so quickly. I'm just so over it. I keep saying the same thing. please, please think of human beings as being equal, as being one race of people, and not dividing them up into subtexts of this, that, transgender, LGBT, whatever, Muslim, Christian. It's just, we're one race of people, and I believe that most people are good people, and they should be given exactly the same dignity as everybody else.
Yes. Final question.
No, we can't take another question. I'm sorry. Is there anyone who has questions for other folks on the panel? Because if you do, you get to jump the line. All right, please.
I just use my chance. My name is Ralf Siener, working for the German Public Radio. I just wanted to know, I heard that Putin makes the work of non-governmental organizations in Russia extremely difficult and sometimes is interrupting the work even. So I just wanted to know if you know more about this, and if also perhaps the Elton John Foundation is confronted with difficulties now, or is perhaps Putin too afraid of Elton John to interfere into his work? I don't know. Perhaps you can say
Alexey, you're involved with an NGO in the Russian Federation. I think you're the best person on the panel to answer that question, if you would.
Okay, I will try to answer it as accurately as I can, because this is a very delicate question, actually. But we have a problem. It's really a problem that if you are receiving foreign money and if you are engaged in political activity, then you can be declared a foreign agent. And then your life will become much harder than it is today. And the hardness of the situation is that all your contacts with government officials will be lost after you are declared a foreign agent. But the main thing not to be declared a foreign agent is not to openly criticize your government. And if you criticize your government, then this critique should be constructive. And that's how we are trying to work with the government officials, because of course, we cannot allow not to work with them because they make decisions that directly impact our clients. We are criticizing them, but we are trying to do it very accurately. And if we criticize them, we are trying to suggest some solutions to them. And I believe that this is a situation that works in every country, not only in Russia. Hopefully, I answered your question. Thank you.
Thanks very much. Please. Yeah, I think this is going to have to be our last questions.
Hello, my name is Oksana Maklakova. I'm from Yekaterinburg. I'm a journalist. In our city, are starting soon a project with ex-prisoners who use drugs. We got support from EU fund. For us, support is sensational. Why Yekaterinburg? And how do you choose which organization to fund?
So she's from Yekaterinburg. She's a grantee.
Yep.
She says the support is wonderful. So how did you decide on Yekaterinburg, and how do you make the decisions about funding?
So the selection process is entirely based on where there is huge need and where we think that there are organizations who have contact with the populations on the ground that really need the support and are going to make the best use of the money in the most effective and strategic way. It's really that simple.
And congratulations on your Elton John AIDS Foundation Award.
Yeah.
Well, ladies and gentlemen, thank you.
No, please, one more question.
All right.
Yeah,
very brief.
Very brief. My name is Jai Verwerda. I'm working for Eva Jinek, a late-night talk show in the Netherlands. My English is not so good as her, but I try to. Sir Elton John, how is it to be here in Amsterdam and at this conference?
How's that?
How's it to be in Amsterdam at the conference? I think you've just answered.
Well, I mean, I was at the Durban conference, and then I was at the Washington conference before that.
Mm-hmm.
It's very important for me to be at these conferences, to do things like this, to see how far we're getting on, to hear new ideas. And, you know, I rant and I rave, but we've come a long way.
Yeah.
We've come an enormously far. I mean, this is the only disease in my lifetime that can actually be ended. That's what's so frustrating about it. It's not cancer. This can be ended. It's not diabetes. This can be ended. So I come here and I talk and I announce new things that we can do, and we meet lots of people that we've funded and meet people that we can fund, and we swap ideas. And it's important for me to be here. You know, not just for you to see me, but it's important for me as someone who started an organization 25 years ago to see what we're doing. We're doing really well, but it just frustrates me that there's these little things or big things that we've been talking about in this meeting and this Q&A. It's very simple.
Yeah.
We can cure this disease. We can stop it.
And
we can stop it. And I'm an optimist, and I will fight to the end. But it might take, say they said, to the year 2030. Bullshit. Bullshit.
Yeah.
It should be stopped in the year 2022. We have if the drug companies come on side and get their act together, if the governments come on side and become humanitarian, we can stop this globally. It's simple. Absolutely simple.
And
okay?
And you are really frustrated about politicians, you said earlier. Can you tell me one more time why?
One.
You're frustrated about politicians. I don't.
Because if you have an end in sight to something, and millions and millions of people have suffered and died because of the disease, and the end is, yes, we have the drugs available to stop this. We can give them to people. We can. It doesn't matter what they are, who they are, what they do, what they love, who they love, blah blah blah. We can do it. We have the drugs available. We have PrEP. We have antiretrovirals. They're available now. We can stop people dying.
Yeah.
But we can't stop people dying if people won't get the drugs to them or won't, because of the hatred involved in. Well, we'll treat straight people, but we won't treat gay people. Yeah. And we can. It's so frustrating. We have the ability to not be here in 4 years.
Okay.
Okay.
Good luck.
Last question.
Sir Elton, I'm from LGV Europe.
Yeah, add something to that.
Could I just wanted to add something as a note of optimism. About 15 years ago, we supported a group called the All Ukrainian Network of People Living with HIV and AIDS, which at the time was about 800 ex-drug users who passionately wanted to do something, who were seeing no services at all and no support and huge stigma against people living with HIV. When you scroll forward another 7 or 8 years, they're suddenly applying to be the principal recipient from the country coordinating mechanism of the Global Fund and working in collaboration with the Ministry of Health for treatment and care. A little bit further on, they've negotiated with the government for reduced drug prices for people across Ukraine. And 4 or 5 weeks ago, we went to Kiev and we visited a brand new hospital for people living with HIV and AIDS and a new app that they're working in collaboration with the Ministry of Health to encourage people to get tested and get on treatment. It is a very frustrating environment. It does feel sometimes like we're going backwards, but we are making huge progress, and there is the possibility to move forward.
And if you saw the most recent UNAIDS report, and I'd encourage everybody to look at it, there's a very stark contrast between the decline in new infections in Ukraine, it's absolutely spectacular, and the rise in Russia. You're absolutely right, and the investments there have really borne fruit. Okay, now you get the last question.
My last question is for Sir Elton John. I'm from LGV Europe, and I'm wondering, what do you think we as an LGBT community in Western Europe can do to help our brothers and sisters in Eastern Europe and to stop this insane discrimination and this rapid expansion of this epidemic?
Advocate.
Be visible. Yeah, be visible. Be visible.
Yeah.
Keep protesting. Encourage your friends who aren't gay or whatever to be with you on this. It's a very important thing for the LGBT community to be as visible as you can. We live in an age where we hide behind our laptops and we hide behind our mobile phones. I don't have a mobile phone, but so I can't hide it behind it. It'd have to be a pretty big mobile phone to hide behind anyway. But be visible. It doesn't. If there's only 100 of you marching or 100, be visible. Help those people and know that those people abroad in those countries that are being vilified, know that there's people out there supporting them. You have no idea how much that helped. When I went to Russia and Anne and I sat down and David, my husband, sat down and talked to these people, they said, "Thank God you came," because so many people said, "Boycott Russia, boycott." They said, "You can't leave people without hope." And they said, to know that people abroad are on our side. It's like when Pussy Riot, came on at the Cup final. Yes! Yes! Somebody is actually marching with their feet. Thank you. And that's what you have to do. And the more you march, the more those people will be heartened, and the stronger their spirit will become. Okay?
Thank you very much.
So, as the first openly gay president of the International AIDS Society, I can say to scientists and doctors out there, be visible too. So, ladies and gentlemen, that's come to the end of our time. I'd like to ask you to please join me in thanking this magnificent group of people for all of their efforts and to applaud these wonderful announcements.
Thank you so much. Really, thank you so much. Working together.
Thank you.
Wonderful.
Thank you, Donald. Thank you.
Oh, thank you very much. This is so special. Wonderful. Yeah.
But it's good.
Thank you.
We need Angus.
We don't need a lot. We need
You're totally right what you're saying.
Yes, like watching BPM. Have you seen the film BPM?
No, you have to. Make yourself be seen and be heard.
Well,
Thank you, Lambert.
Thank you. Well done.